This topic is fetal alcohol syndrome, also known as FAS. Fetal alcohol syndrome is a condition that can cause brain damage and growth problems. This occurs when alcohol is consumed by the pregnant mother. As we know, any type of oxygen or nutrients that the mother intakes will pass through the placenta into the fetal bloodstream. As you can see in our illustration to the right, the alcohol freely passes through the placenta and the fetus is then exposed to alcohol. Teratogenic risks for fetal alcohol syndrome include permanent physical, developmental, and cognitive abnormalities. Fetal alcohol syndrome is the leading cause of preventable intellectual disabilities and developmental delays. Let's discuss some of the physical features of FAS. Now, when the infant is first born, they will have some level of withdrawal since they've been exposed to alcohol. This level of withdrawal can be on a spectrum or fluctuate between mild to severe. And the severity of the withdrawal depends on how often or how long the client was exposed to alcohol in utero. Signs and symptoms of alcohol withdrawal include those with any type of withdrawal, jitteriness or irritability. These clients will also have an increased tone and reflexes. There will also be an abnormality in the facial features. So just make sure you think of smooth and small. As you can see in the illustration to the right, the client will have microcephaly or a small head. They'll also have small eyes. They'll have a flat midface, and this is due to that low nasal bridge, as well as a smooth philtrum or a lack of indentation on the upper lip. Their upper lip will also be very thin. Let's discuss some of the developmental and cognitive manifestations in clients with FAS. Remember, these clients have experienced brain damage since in utero, so because of this direct brain damage, we're going to see manifestations across developmental delays as well as these cognitive delays. These clients may express a weak suck reflex and therefore will have poor feeding, which can then even lead to failure to thrive. These clients, when they're first born, they're going through withdrawal, so as we discussed, they'll be more irritable or jittery, and they'll be very sensitive to sound, so they need to be in a low stimulus environment. As these clients get older throughout childhood, they may be more hyperactive or inattentive. The clients are at risk for failure to thrive due to their poor feeding. These clients may have poor social skills and start to isolate or withdraw themselves from others. They can also have learning disabilities, and we'll see this in school. They may have poor success in school. The clients can also experience hearing impairment and fine and gross motor delays. This can include poor handwriting and even poor coordination. So how can we best care for these clients? We want to make sure we're doing daily weights to ensure they're gaining weight. Monitor intake and output, making sure they're hydrated and having enough nutrients. Monitor for hypoglycemia, again, making sure they're taking in enough nutrients and not experiencing a low blood sugar. Seizure precautions need to be implemented. Due to brain damage, these clients are at higher risk of seizures. Measuring the head circumference and monitoring the head circumference growth over time is important, as these clients are born with microcephaly, that small head. Monitoring suck and swallow reflex is important as well, ensuring the client can eat safely without aspirating. Because these clients, when they're first born, are going through withdrawal, we need to decrease environmental stimuli since they're so sensitive to sound. And also incorporate small, frequent feeds to ensure that they're able to tolerate their feeds and get the nutrition they need. Now, it's very important to note and to teach our families, no amount of alcohol is safe during pregnancy. But discontinuation of alcohol consumption at any time during pregnancy can be helpful for outcomes. Alcohol consumption during pregnancy does not only increase the risk of fetal alcohol syndrome, it can also contribute to many other issues, such as miscarriage, preterm birth, or even stillbirth. It's important to implement early interventions such as speech therapy for clients with fetal alcohol syndrome. This is important because the earlier the intervention, the better the outcome. Breastfeeding can continue and is not contraindicated if the client has stopped drinking or consuming alcohol.